Welcome to Staying Connected, a podcast where I talk to people about their stories with VEDS, Marfan, Loeys-Dietz, and related vascular and aortic connective tissue conditions. The views, information, and opinions in this podcast are those of the individuals involved, and the information presented does not constitute medical or other professional advice or services. Welcome back. Today, we're going to talk to Erin Langley, who was tested for Vascular Ehlers-Danlos Syndrome, or VEDS, due to some concerning family history, but her results came back as a variant of unknown or uncertain significance, or VUS, meaning limbo. Before we get into the interview with Erin, if you like this show and you want to help our communities raise awareness of VEDS, Marfan, and Loeys-Dietz, there are now a couple ways to support the show. You can now buy merch, including tote bags and t-shirts, and new designs are coming soon. A link to the store is in the episode show notes. You can also support the show by joining my Patreon. It's a fantastic way to support the podcast, and the show wouldn't be possible without the continued support of my subscribers there. If you've already been supporting the show, thank you. Let's get into the interview. Hey, Erin, thanks for joining me on the podcast to share your story with a variant of uncertain significance for COL3A1 or VEDS. I'm so excited to have you on the podcast to share your story. You're the first interviewee on the show that has had a VUS, and I really appreciate you coming on to share your experience with that. So thank you.
Thanks for having me, Katie. I really appreciate the opportunity.
Yeah. Do you want to introduce yourself to people who don't know you?
Sure. My name is Erin. I recently turned 38, so I'm 38 years old. I live in Western Colorado now. I grew up in Central Kansas, and I am right now a stay-at-home mom. And I had genetic testing in October of 2021, so I'm about getting close to 3 years into this journey. And it's been a long processing type of journey. So I'm glad to be able to share where I'm at now. And I do hope if there is anybody else out there in my situation that hopefully they can skip some of the steps that I took in coming to terms with this. I really felt like at the time when I got my genetic testing results that I was the only one in the world who had this, and that's not true. There is others like us out there. And if you are out there and you are dealing with this similar results, there are others like me who are trying to figure it out too.
Yeah, for sure. And that's why I'm so glad that you're on the show. So thank you.
Thank you.
How did this come up for you? Like what led to genetic testing in October of 2021?
Well, my mom had died, my biological mom, and I'm adopted. So I had found out about that in April. My family had gotten a hold of me. My biological family had gotten a hold of me to let me know that she had passed away, and it had been sudden in her sleep. And at the time, I had been told that she had passed from an organ rupture. I did go on to find out that her official cause of death was abdominal bleeding. So the organ rupture, I don't really even know if that is what happened, but it was what first I was told. And that didn't bring up any red flags to me at the time. For whatever reason, I didn't think that it had any effect on me, I guess. And it was, I think, a little while after her funeral that I think it had been bothering me in the back of my mind. And I had Googled her name to get a picture of her from her funeral, just for my own sake. And immediately when I Googled her name, her sister's obituary popped up right next to it. So it's the two women's faces there. And that was the first maybe inkling that something was not right, because both of these women were young. They were in their 50s. and my aunt had passed away 10 years prior. So I hadn't thought about that when my mom had died. It hadn't even crossed my mind, which looking back on it now is kind of embarrassing that I didn't even have any connections there with that. But when I did months later see my aunt's picture, I had never heard of vascular Ehlers-Danlos before my mom had passed. And something about my mom and my aunt's deaths, both occurring in their 50s, had, I couldn't sleep at night. So I was Googling things, like trying to find some sort of a reason why both women would have that problem. Oh, and the other thing I didn't mention is my grandmother had 2 abdominal aortic aneurysms. So some combination of like my family history in Googling terms had pulled up vascular Ehlers-Danlos syndrome, and I had never heard of it before. And I had heard of Ehlers-Danlos syndrome, and I had actually thought I had like the hypermobile type for years prior to this, but I didn't think it was anything I needed to look into more. So I Googled, I think I might have Googled organ rupture. That would make the most sense as to why I landed on the VEDS movement page, but I did. I landed on the VEDS movement page, I think was the first page I found, and it had a checklist of criteria. And that was like a separate Googling experience than when I had Googled my mom and found her picture. And they both stick out in my mind because both of them were like, I felt like I got punched or kicked. Like it knocked the air out of me. I was reading this criteria, and I felt like every single one of them described me. I think I printed out that criteria list of major and minor criteria, and I think I brought it to my primary care doctor. I had made an appointment with her and just, basically went in and said, this is weird. And I know I'm like 38, or at the time I think I was 35. I'm only 35, but I have all these things that match this piece of paper that are for a genetic disorder, for a connective tissue genetic disorder. And then my mom just died, and it seems like that might be related. And she immediately was like, wow, we're going to get you in. I had to drive to Denver. It was a 5-hour drive to see a geneticist, but she immediately got me in. I think they called me the same week I had a doctor's appointment. So it was like, when you have referrals to places, a lot of the times it's weeks or months. And when the geneticist had called me in Denver to get me in there, it had seemed really rushed. And really, she had even said on the phone, she was like, this is a really serious disease and your family history is alarming. So we're going to get you in and just go ahead and give you the blood test. And in my mind, it was as cut and dried. I hadn't done a lot of research about VEDS. I had read the criteria and I was concerned. But in my mind, it was a really cut and dried experience. You would go to the geneticist, they would take your blood, and you would get a simple yes or no answer back. They had even warned me when I went in to see the geneticist. She had said, there is a chance you could get what's called a variant of unknown significance. And in my mind, I remember when she said that, I just immediately was like, that doesn't apply to me. You're going to take my blood. It's going to be a simple no. And then I can move on with my life. Not a big deal. I had already I went into the geneticist appointment. Honestly, I was kind of mad. I was not in a good headspace when I went in there, and I didn't have a whole lot to back and forth to give to them. I'm just like, give me the test, take my blood. We'll be done here. You never have to see me again.
Yeah.
And that didn't turn out that way. They didn't.
Oh, go ahead. Totally. I think before we move on, before we continue, do you know how your aunt died?
Yeah, my aunt, my biological mother had called me in about 2010, 2011, somewhere around there. And we had a relationship. So we talked quite a bit on the phone. And she had called me to let me know that my aunt was in the hospital and that she had, they described her as just being fragile and getting more fragile somehow as time went on. And gosh, it's hard for me to say because I had never met my aunt, and I don't want to say anything about her medical history that she wouldn't want to share. But I know that she had, at the time of her death, she'd had a colon perforation in the previous history, not what was acutely going on at the time, but at the time when she passed, she had, it was described to me as she had multiple things go wrong at the same time, and they couldn't get any of them fixed. And they told me that she just had tubes everywhere, and it didn't, nobody could fix anything. So she just passed away. And when that had happened in 2010, it was concerning to everybody in the family that was going on. At the exact same time that was happening, my grandmother was in the hospital having aneurysm repair. So that kind of took, in my mind, I was thinking more about my grandmother, and I didn't know my aunt was going to pass at the time. And then she did pass from that. And my mom had called to let me know that both of these women were exhibiting these health problems at the same time, and it was concerning to her. And at the time she'd called to let me know that I was having health problems. And in my mind, my response to my birth mom was kind of like, well, I can't handle this right now. I got my own stuff going on, so probably doesn't have anything to do with me. Mm-hmm. I feel guilty about that now, but I was young, and I didn't understand that your family history could have any sort of a bearing on your own health. I think that's one of the things about being adopted that is difficult for adoptees, is you don't know your family history, and you don't, a lot of the times, and you don't grow up with that genetic mirroring. So you don't see, other people who share your genetics, and how their bodies are. But I didn't really think it applied to me at the time, is the truth.
Well, you bring up something there too that I was going to ask about your own medical history. So you said that when you saw the information on the VEDS movement site, that it was like a gut punch or took your breath away, is very familiar. What kind of medical problems had you had, and were you having? And what did you see, I guess, on that checklist that described yourself?
The first thing I remember on the checklist that felt like a punch in the gut was the facial characteristics, because I do have a really thin face and thin features, and I always have, and I don't have earlobes. So that maybe was the first thing that I was like, what? And then the bruising, the easy bruising was alarming to me, because I've pretty much my whole life been covered in bruises. But that's always been weird for me, the bruising, because I genuinely thought that my bruising was because this is like internalized stuff, but I thought it was because I was clumsy or a tomboy, or that when I was growing up, that's what I was told. Like, you need to be more careful and you're a tomboy. So my bruising had always been noticeable. People mentioned it to me my whole life, and I've just always thought it was my own failings as a human. So reading that that's like a symptom of something was pretty, it really changed the way I see myself. I was like, oh, wow, this is maybe not my fault. And then that's also part of the complication of getting the test result back as a variant of unknown significance, because I still don't know if it's connected, and I won't until they find a way to, they have to clarify the variant. Mm-hmm. That's kind of the confusing part about it is, you can have some of the criteria and still not know if it's connected. But the health problems that I was having at the time my aunt passed away and my grandma was in the hospital was I've always had these bouts of vasculitis. Mm-hmm. They just kind of crop up randomly, and I've had them my whole life, and they haven't been a big deal. But around that time in my 20s, I don't know if it's because I was working really long hours on my feet or if I was stressed out, but I got this really bad case where it covered my entire lower body from my stomach down in my feet, and it was extensive. So I'd gone to the dermatologist, and they'd taken a skin biopsy and sent it to the Mayo Clinic of all places, and they couldn't come up with an answer. They just called it idiopathic vasculitis. And then around the same time, I lost my gallbladder, kind of out of the blue. Looking back now, I could see that symptoms were there, but I didn't realize they were there. because I was so young and I hadn't known anybody that had happened to. So, yeah. And like the 2 years that my aunt passed away, there was like multiple medical things going on with me that, we couldn't figure out. And it was just kind of the same thing each time, like, oh, well, we don't know. And then I always had hypermobility, maybe even, I would even say I seem more like a hypermobile Ehlers-Danlos type person, because hypermobility is so extensive with me. It's not just my small joints, it's my hips and my back are maybe the worst. And I've sprained my ankles so many times that, yeah, I don't know. I just wear special shoes now and deal with it.
Yeah.
And then reading more about Ehlers-Danlos syndrome, a lot of the hypermobile stuff really resonates with me, especially I've had a stomach ache since I was in kindergarten, I think. I, definitely relate to a lot of the joint pain stuff. So when I had read about that, that was, kind of transformative for me to be able to connect that and say, oh, that might actually be what's going on with me. It's not just that you're lazy or weak or you're not trying hard enough. I remember when I was a kid being told you can't have a stomach ache 3 days in a row. That's not how stomach aches work. And, I was like, oh, well, I guess I don't have a stomach ache and I'm just, I don't know.
Well, going back then, so then you get this VUS. And for our listeners that don't know what a VUS is, it's basically a genetic mutation or variant where there hasn't been enough research to show whether or not it's pathogenic, which means disease causing, or not. And so then further research has to be done. And the hope is that, more people who are identified with that variant will paint a better picture for researchers to let them know whether or not that genetic variant is significant in some way, one way or the other. What was that experience like for you, getting that VUS?
Well, I remember being on the phone. This all happened during COVID. Well, not during COVID, but when it was still, people were being pretty cautious. So my test results, they called me to give me to them. They didn't want me to come in. And it was a short phone conversation. And she had just said, she started with, the good news is that you do not have a known pathogenic variant for VEDS. And I immediately was like, yes, I felt great. And then, I think she waited a few seconds for me to stop and then was like, you do though have this thing, variant of unknown significance. And then she started explaining my specific variant. She's like, it doesn't occur in the healthy population. And then she had said, they do these online computational protein models that they kind of try to see what the variant might be doing. And she was like, the good news is we don't have any evidence from this that your particular change would be causing a problem. But these models aren't, I guess, held in too much of a high regard. They're kind of just experimental models, and we don't really know how collagen molecules work. So it seemed very I got the feeling right off the bat that I wasn't going to get any more information. And I kept asking her for more information. I felt like she was being really careful with her words. I took that initially as, I'm embarrassed to say, but I took that as, she probably doesn't like me and this is personal. And and that was not a healthy response. I now know. But I didn't understand. I truly did not understand. There is nothing that anybody who has their job on the line for this is going to be able to say about this variant. Not a single thing. And anybody who is going to say that this variant is or is not doing anything is not betting their job on it. They're not geneticists. So their opinion isn't, going to hold any weight here. And that realization was another punch in the gut. That was probably the third punch in the gut. I got off the phone with her and I did try to really take it at face value. I called my friends and family who are waiting to hear from me about this and was like, good news, I don't have a pathogenic variant. And then, like my geneticist did, I just slipped it in at the end, oh, but I do have this unknown thing. and nobody that I talked to knew what to do with it too. Now, I mean, who would? There's nothing to know about. And then that's when I turned to Google, and that was really hard. I typed in, I think one of the first things I typed in was the gene COL3A1 and hypermobile, because that is my number one symptom, I would say. And the very first thing that I found was a case study of somebody else with the same protein change as me. I have an isoleucine molecule change and the same protein change as me. And his was proven pathogenic, and he was hypermobile. That was his main. He's hypermobile and had a lot of the same like muscle type problems I have. So I can't extrapolate anything from that in reality, but for me, like, I mean, I panicked, and I continued to Google. I continued to find more really distressing information, especially in terms of like variants of unknown significance on this gene. Like, I kept finding these case studies of people who had variants of unknown significance, who then they got on to be classified as pathogenic for VEDS. And a lot of them say the same thing, that previously they were variants of unknown significance and they were not expected to disrupt protein function. And I'm like, well, these are the same words that my geneticist used, and I don't understand why mine would be fine. Like, and if it's not fine, why is nobody doing anything? And then that was kind of the whole, I don't know, that switched me from anxiety to depression, I think, because I really thought like the American medical system, I had a different idea of how things worked, and everybody's done their amazing job so far trying to help those of us out here with these. But at the end of the day, the information that I found is that we don't really understand the collagen protein molecules well enough to even begin to classify unknown variants. So it is just people who get the test result that I get are just kind of sent off to the waiting room, and we ultimately have to have the biochemical analysis done to be able to switch that variant classification either way. So it's kind of a frustrating situation to be in. The biochemical analysis is expensive and time consuming. It takes years. I saw one thing that it takes 3 years, and then I saw another thing that it takes 6 months. So I'm not sure on that, but I know it's expensive. Yeah. And we don't even have a collagen laboratory in the United States anymore that does do that, because it is so expensive and time consuming that genetic testing is taken over as the primary means of diagnosis. But then what about people like me?
Right, for sure. So did they do baseline imaging or anything? Or like, do they treat you as if you might have vascular issues and monitor for them? How do they like care for you medically?
I think for everybody, it's going to be on an individual basis with these variants of unknown significance. But I've been really lucky. My primary care doctor, who sent me to the geneticist in the first place, when I came back with these results, sitting in her office, just absolutely freaking out about them. And she's like, I hear you. She gave me a working diagnosis of vascular Ehlers-Danlos syndrome, which just kind of protects me in case I do go to the emergency room and I have something, that I'm concerned about. So I'm not brushed off as it being anxiety. And that's a big for me. When I lost my gallbladder, I had gone to the ER, and I was really lucky that my stepmother was with me, because they were going to send me home. They thought that I was drug seeking, because I was telling them I was in pain, and I'd not been to the emergency room with anything like that before. So it was very scary to me that could happen. Yeah. Like, you could go in there with a serious problem, and they might be like, have you considered that you're faking it? So she really helped me out by putting that on my chart, and also went ahead and did all the baseline imaging, CTAs, and they all came back relatively normal. It came back with stuff that now needs to be monitored. And that's kind of the unfortunate reality of any time you do a big scan like that, is you're probably going to find something that is questionable that they're going to want to keep looking at. So I wasn't super pleased to learn I'm going to have to keep coming back and do that repeatedly. But ultimately, I'm just grateful that they were willing to take it seriously and not totally brush me off. My problems that they did find are probably not VEDS related either, I should say. It's like some lung nodules and some other stuff like that most likely totally harmless, but keep an eye on it.
Mm-hmm. Yeah.
And then I did also get a cardiologist and a pulmonologist, and I do have like a care team set up.
Yeah. Have you met other people with VUSs or talked to them?
Online, I have. Yeah. Never in person. I've never met another person in person that has any sort of Ehlers-Danlos, I don't think. But yeah, through online support groups and stuff. Yeah, I want to say real quick, since I mentioned support groups, when all of this stuff was going on for me, after I had gotten the phone call about my results, and I was in just like a total panic, and I couldn't figure out, my geneticist had suggested I find a support group, but I didn't even know what that meant, what kind of support group for what. And I reached out to you, Katie, and it was the lifeline that connected me to the support groups that I did need. And I wanted to mention that because I am so thankful. I don't think I would have been able to find anybody else that had a VUS on this gene otherwise. And because I was able to find other people going through it, it was really helpful to hear their experiences. Some of them had the biochemical analyses back when they used to do that here in the US, and they had found that their variants were milder. They were like causing a milder form of disease. And that to me was really comforting. I think initially when I had gotten these test results, my mind went to worst case scenario. I have undiagnosed VEDS, and I, am not, nobody's recognizing this. And now I've come to realize years later, after having really looked at it through my own lens of my own health and even my family history, I don't think whatever I am going through is anywhere near as severe as what people with pathogenic variants on this gene are experiencing. And my firsthand experience of that has been with you. When I contacted you the first time, you were in the ambulance having a splenic rupture and you're still helping me. And in the years since I found my variant, I've been watching you go through, multiple major health events, and I have had none in the meanwhile. So it's been really helpful to connect with other people with both the mild, like kind of presentation like me, and people who have diagnosed pathogenic, severe, like the glycine substitutions and the splice site substitutions, from what I understand, are considered the most severe. Is it phenotype?
Yeah, that's a great. I think that's a good word for it. Yeah, phenotype.
Yeah. And the other, these other variants of unknown significance, I'm not saying that they're not doing anything, and I'm not even saying my opinion means anything either way, but I have come to a place within my own personal journey in this to, I do think that they are milder, and that will come to light through, eventually there's going to be new information coming to light.
Yeah, let's talk about, before we jump to that, I do want to jump to that. Before we jump to that very important discussion and research, for anybody who's listening to this who has not connected with somebody else who has a VUS and you were just diagnosed with a VUS, there is a support group on Facebook called, is it Vascular Zebras now, or VEDS Zebras? It's changed names a couple times, but that's there. And I'll put the Facebook group link in the description or the episode show notes. And then there's also a support group with the VEDS movement for people who are awaiting diagnosis. And that also can include people who have a VUS. So I'll link that in the episode show notes as well. Let's talk about research. there was a big announcement. We're recording this in June. Anybody listening to this in July or August, surprise, it's June. Annabelle's Challenge just came out with an announcement about a VUS research study. And I know that you've read about that. Do you want to explain, your understanding of that study and what it means to you?
Yes, I am so excited about this. This news it's just a few weeks old. So, or even that. So, I'm still kind of processing it, but, the Annabelle's Challenge announced that they are doing a big research project starting in January of 2025. From what I understand, they're going to be using the CRISPR gene editing tool to insert these unknown genetic mutations into zebrafish, which are like a tiny little nanofish. And then they'll be able to compare that fish with a healthy control model and also a model that has one of the known pathogenic VEDS variants. So they'll be able to get a feeling for what some of these variants are going to do. And I don't know if that's going to clarify for me, because I don't know which variants they're going to use. I'm assuming, the research is just going to keep moving forward in the right direction. So just the fact that they're doing this is huge. And the first, this is the first real sign that I've seen, and I've contacted most of the professionals trying to find answers here. This is the first clear sign that they are going to be clarifying some of these variants. And I think the variant of unknown significance, just that on its own is a stressful thing for geneticists to deal with. They don't have any more answers than anybody else does, and they don't like to give that result to patients because it can be really psychologically distressing. And I know that firsthand. The first year after I got my news about my variant, I lost a ton of weight, got really underweight. I was having panic attacks. I did eventually, I got a therapist, and it helped a lot to seek therapy for it, but it was devastating to my mental health. And I know it has been to other people I've talked to. And from what I've heard, they being the science of genetics in general, wants to eventually do away with variants of unknown significance as a classification, because it's not helpful in either direction. But you can't do that without having some information either way. So these gene editing models are going to give the concrete evidence that we need to classify them. And without the biochemical analysis or looking at these zebrafish models, there really isn't any other way except for wait for enough people to test positive for it. And even then, I think it's 27 pieces of clinical evidence that you need to reclassify. So that's a whole lot of people sitting around waiting for, so big news for us with VUS that they're going to be doing this zebrafish thing.
Yeah, it sounded like when I read it, I was very enthused, I guess. I always use the word excited, but I was very enthused because that research does need to be done for people who receive this, I want to say diagnosis, right? But this variant. And
yeah, it's not a diagnosis. Yeah, that's the thing.
That's the thing. And, we're generally advocating for more genetic testing, and genetic testing has become more available and is probably going to be continuing to become more available and more affordable. And so we're probably going to get more of these VUSs, and we have to be doing something to make sure we're still working towards those answers, for sure.
I just wanted to say too, through my own research I didn't know anything about collagen type 3 or vascular anything before this, or genetics. But just through my own research, it doesn't take long you don't have to Google very far to figure out that we really don't understand these collagen molecules well enough to come up with an effective therapy. I mean, it's firsthand knowledge for you, but it's there's a benefit to everybody if we can try to understand better why some of these mutations are causing problems, and why some of them appear milder even. I think that information helps everybody who's affected by these collagen disorders, collagenopathies, or whatever. On any of the collagen genes, they're very complex molecules. Yeah. So, and the researchers who are doing the work are incredible. I am so grateful for them, and I don't want to in any way, shape, or form make it sound like I don't think they're working hard enough towards this, because obviously people are working very, very hard. It's just there is questions that remain unanswered, and I do truly think that everybody's going to benefit when we get some of those answers.
So that you started talking about the things that helped you when you were kind of going through processing this information after you got that test result. For anybody who's listening to this who just got, that test result of a VUS, what do you recommend that they do? Or what helped you? Like, what advice do you have for them to get through that really terrible period of time?
Well, I think it applies to anybody going through anything in your life that you are struggling with, that you have to take care of your mental health first and foremost. I remember for me being kind of frustrated when people would say to me at the beginning, like, hey, you're clearly really anxious about this. Like, talk to somebody, get a therapist, talk to somebody. I remember thinking, like, are you saying that this is all in my head? But that was never the point. And it took me a while to understand that it doesn't have to be all in your head for it to be affecting your head. And coping with that with a therapist really helped me. The support groups were incredibly helpful to me, especially finding other people I could connect with who were in this weird variant of unknown significance boat. A lot of people, there is a lot of people out there if you know where to find them. And, I did find an article, somebody else sent it to me, but I'm going to mention it here. I can't take credit for it, but somebody else had found it and sent it to me to be helpful. And it was called The Known Unknown, The Challenges of Genetic Variants of Unknown Significance in Clinical Practice. And this article talks about why these variants of unknown significance are not always readily shared with the patients, or they used to not be. It talks about a case study in this about a little boy. It is a sad story, but he had seizure syndrome, and he had genetic testing to look for the cause of the seizure syndrome, and they had found a variant of unknown significance for Dravet syndrome, which is a childhood seizure disorder. Because it was a variant of unknown significance, they didn't disclose that to the parents. And subsequently, this little boy was put on medication for his seizures that is not indicated for people with Dravet syndrome. And the little boy passed away because of it. And the argument behind that is why people are entitled to their health information. They're entitled, also to misinterpret that if that is their choice. And that's something that I struggled with my test results. Like I said, at first, I genuinely felt like I had undiagnosed severe connective tissue disease that was, I was not able to really see it through the lens of my own experience. And that's a definite downside to encountering these test results, is when it is so open to interpretation, it's so unknown, you can interpret it however you choose personally, and you can be dead wrong about that. And, the only person who's going to have the consequences of that is you. And that's a real challenge with it, I think. And why geneticists don't like these variants of unknown significance. They're not a comforting result.
Right.
So, but I think anybody who is listening to this who has found themselves in these shoes, likely has already done the Google dance and tried to find the information that you can online. And yeah, I guess the one thing I would want to stress is just realize that not all of that information is necessarily going to apply to you in your specific situation. And just remember, your body and what you know about yourself is the number one thing that you should make your personal decisions on, not something that you read might happen on the
Right.
internet.
Yeah. And I'll link that article too in the episode show notes if anybody wants to go and read that. And I guess lastly, like, what do you want medical providers to know about what it's like living with a VUS? Like, I've heard some really clear things about the kind of unknown and the weight of the unknown and, you know, the research that needs to be done in this. But as far as your like day-to-day life living with a VUS and also being kind of monitored as if the diagnosis was potentially pathogenic, but also not, you know, like, what is that experience like? And what do you want medical providers or medical students listening to this to understand about that experience?
I think looking back on the way I handled it at first and my interactions with my own doctor and the specialist that she then referred me to, I think most medical professionals who are listening to this already know that a lot of these Ehlers-Danlos syndromes are not apparent at first when you first see someone from a distance, especially. And I know for me, I walked into a couple offices where I was just immediately one vascular surgeon. I'd gone in there to get something checked on my leg, and she had said, "Well, you're the youngest person I've seen in years." And the way she said it was just like, "You don't belong here." But I do have a problem with the vasculature in my leg, so I do belong there. I think a lot of people with Ehlers-Danlos syndrome in general run into that. Like, and then, you know, going through my fears about my own health with this unknown variant, I think it's hard for medical professionals to separate. There's an anxious young woman in my office but these things that she's concerned about are, you know, objectively real and in her past. Yes, she's anxious.
Right.
Yes, she's anxious. Yes, she probably does need to calm down a little bit, but yeah, also, you know, that doesn't make these concerns less valid, I think. And yeah, I think we just want answers. That's all.
Yeah.
I just know I want answers in my lifetime. I don't know if I will get them. I know that there's a chance I might not. But it has nearly become a life goal of me to try to find some sort of an answer. And that's like the open-endedness of it never goes away. And it's just a constant question in your mind. So I guess that's the part that I wish my doctor could really see, is that, you know, the unknowns of it and the anxiety behind it. It feels like a permanent part of me now until I have some resolution. And I think I would be concerned about my health and my general presentation and with my family history, even if my test had come back completely negative. I've played this through in my head. If my test had come back completely negative, I think I would still be asking questions. They would just be different questions.
Mm-hmm. Yeah, because you do have a significant family history.
Yeah, and even if you take away everything else, people who are hypermobile have health problems specific to hypermobile people. Mm-hmm. And that is the case, whether they want to call it benign hypermobility syndrome or, you know, or they want to give you a diagnosis of something. Either way, these hypermobility, it's kind of a hard thing to deal with in general. It's an invisible thing that causes its own set of problems. Mm-hmm. And yeah, pain is just a part of living when your body bends in ways it's not supposed to.
Yeah, that's a good way to put it. So. Well, thank you so much for coming on and sharing your experience, and for, you know, being the first person with a VUS to come on the show. I really appreciate that so much, because I think that the we need to hear more about the lived experiences of what it's like to have a VUS and understand that better. And also, my fingers are crossed for you that, maybe this upcoming study gives us answers on your specific VUS, but also that research does not take your whole lifetime to find an answer for that.
Thanks, Katie. I really appreciate it.
Yeah, no problem.
And if my variant ever does get reclassified, maybe you can have me on.
Oh, yeah, for sure.
No, I'm just kidding.
Oh, no, I'm serious. I think that would be great to talk about that, because that's going to invite a whole different set of questions or realizations or, one way or another. That's a whole new life experience. So
it is definitely a unique experience. Mm-hmm. Thanks so much for letting me share. And I really appreciate it. You've been such a help to me in this journey. My story is a testament to your reach, because I don't know if I would have found information about vascular Ehlers-Danlos syndrome without the information that you have out there or had put out there in 2021 that I could find. And I am very grateful for. It's been a journey. It's not always been a fun journey, but I'm really grateful for it.
Thank you. I'm so glad it was helpful. Thanks for listening to this episode featuring Erin Langley, sharing her story with a VUS on COL3A1, the gene associated with vascular Ehlers-Danlos syndrome. Next week, we'll talk to Maggie Buckley, who was diagnosed with hypermobile EDS as a child and has been a longtime advocate for Ehlers-Danlos and connective tissue conditions. Genetic testing recently revealed she has a type of Loeys-Dietz. If you're ready to meet others, get involved, or need support, there are links for you in the episode show notes, as well as information on how to sign up for the VEDS Collaborative, a research study for people with VEDS, Marfan, and Loeys-Dietz. And I believe this study also includes people with VUSs. If you like this show, be sure to share it on social media or give it a rating or review. You can also support the production of this podcast by joining my Patreon or by buying merch. As always, my top tier patrons are listed in the episode show notes. If you want to be on the next season of the show, there is a link in the episode show notes to get on the pre-interview calendar. I'll be starting the interview process for next season in September. See you soon.